Good evening. Can you hear me? Yeah. No? Good. How's that now? I'd like to begin by acknowledging the Honourable Jillian Skinner, Minister of Health and Minister for Medical Research, the Honourable Melinda Pavey, MLC, Parliamentary Secretary for Regional Health, Dr. Mary Foley, Director General, New South Wales Ministry of Health. I would like to show my respect and acknowledge the traditional custodians of the land, of elders past and present on which this meeting takes place. Ladies and gentlemen, good evening and welcome to the Western New South Wales Health Forum. We are delighted to host the first Regional Health Forum at the invitation of Minister Skinner and to welcome so many representatives of the communities we serve. Today is a significant one and a historical one. Tonight, the New South Wales State Government has provided an opportunity for you to have input into how health services in our local health district can be more focused on what you need. The Minister for Health and her esteemed colleagues are here with open ears to listen. I'm Robin Williams, Chair of the Western New South Wales Local Health District, which formed on the 1st of July 2011 and is one of the largest rural health districts in NSW, akin with the area of Great Britain. I'm a GP in Molong and a VMO at Molong Hospital, and together with board members Associate Professor Joe Canalisi, Mrs Patricia Doolan, Mr Scott Griffiths, Dr Darryl Mackender, Ms Julianne Marr, Mr Paul Mann, Dr John Tooth and Mrs Joan Treweek, we are responsible for the strategic leadership of the local health district. The local health district and its board was formed following state government reform, which saw the abolishing of the former area health services and a move to devolve decision-making about the provision of health services closer to the patients. It is no secret that our local health district is geographically very large and faces many challenges unique to rural areas in accessing healthcare. I'd like to give a brief background on the LHD to set the context for this evening. The Western New South Wales Local Health District serves an estimated population of just over 266,000 people, which is 3.9% of the New South Wales population. The population is dispersed across the area the size of England, Scotland and Wales, and contains 23 local government areas. 7 of these LGAs are classified as remote or very remote. Most of the population is concentrated in the LGAs of Dubbo, Bathurst, Cabonne, Orange, Midwest Regional, Parkes, Forbes and Cowra. There are 38 inpatient facilities ranging from major rural referral health services in alphabetical order, Bathurst, Dubbo and Orange, to district health services at Cowra, Lachlan and Mudgee, and multi-purpose services in many towns across the LHD. I think it is important to discuss some of the challenges that face us. People living in rural and remote areas generally have worse health than people living in metropolitan areas. Compared with people who live in major cities, people who live in remote areas can expect to live about 5 fewer years, are more likely to die early and from causes classified as potentially avoidable, report greater difficulties in getting health care when they need it, are more likely to be hospitalised for conditions for which hospitalisation can be avoided through prevention and early intervention, are more likely to be overweight and obese, are more likely to be hospitalised for heart disease. I would like to talk about mortality or death. Life expectancy at birth is 77 years for females and 76.9 years for males. Both these figures are significantly lower than the New South Wales figures of 84.4 years for females and 79.6 years for males. Leading causes of death are cardiovascular disease, chronic obstructive pulmonary disease, cancer, the highest being lung cancer, fall-related injury, poisoning and diabetes-related conditions. Death rates of people living in Western New South Wales Local Health District vary by local government area. Differences usually reflect the level of remoteness and the proportion of Aboriginal people living in the LGAs. Generally, people living within the Western New South Wales Local Health District have significantly higher levels of potentially avoidable deaths, deaths attributed to smoking and alcohol, and deaths from cardiovascular disease compared to the rest of New South Wales. From mortality, we move to morbidity, or sickness. Residents of the Western New South Wales LHD have significantly higher levels of hospitalisation attributable to being overweight, smoking and alcohol, and hospitalisation for cardiovascular and respiratory disease. These realities are married with difficult challenges in dealing with them, including an ageing workforce, difficulties in attracting, recruiting and retaining doctors, nurses, midwives, allied health workers, increasing demand for services, a rising cost for maintaining services and escalating community expectations. We have a complex problem on our hands. But this is not all doom and gloom. We live in a fantastic, clean, safe area of the world, and compared with the vast majority of our peers overseas, have much to be grateful for. But we still need to make things better for our communities in closing the gap in health between ourselves and metropolitan areas of the state, and in particular in closing the health gap between Indigenous and non-Indigenous members of our community. And for this, we must have a robust, evidence-based strategy for the future. The Western New South Wales Local Health District Board has welcomed the opportunity to take the Minister for Health's vision to devolve decision-making on health closer to the patients, and we take our responsibility very seriously. We see that there are several opportunities for the Western New South Wales Local Health District to overcome some of these challenges. Engagement with our communities and our clinicians is one of the most important steps in achieving this goal. We aspire to become leaders in delivering accessible healthcare. The Board shares the Minister's vision to establish strong foundations for the planning and development of all health services through robust community and clinician engagement, through the network of health councils and clinical councils. The Western New South Wales Local Health District Board understands that to ensure we have the best systems in place, that we need to look at mechanisms for advancing partnerships. Some we will need to develop as new organisations, such as the Medicare Locals evolve, and some existing ones that we need to build upon, such as with Aboriginal health services, private providers, universities and other education facilities. We need to be transparent. Whatever we try and do, we must remember the person at the core of our efforts, our patients. So the Board's strategic vision for the future includes taking ownership for the poor status of health in our local communities. We acknowledge that we need to be more proactive in sending health promotion messages to the community, to have a plan to work closely with the Medicare Locals and engage our partners more effectively. The strategic vision includes matching need to service delivery. We know that we must listen to our patients, our clinicians and our communities to understand how to provide equity of access to services throughout the district. Developing clinical networks is a priority, in particularly starting with cancer and diabetes networks, because they are so crucial in this LHD. We must promote the district as a whole entity, formalise specialist linkages within and outside the district, so that we can present the district as a sound organisation and gain more efficient control of resources. Workforce planning is of utmost high priority. We have an ageing workforce with difficulties in attracting and retaining health professionals, and the high cost of agency and locum costs are of great concern. The Local Health District Board has recognised the need for immediate action and strategies to address workforce challenges. The Board acknowledges the relevance of other service providers, regardless of size, in assisting the local health district to make services more accessible and to avoid duplication. Importantly, I stress again that our linkages and partnerships with universities and education providers are vital, and the Board recognises that the local health district can harness the rewards of these relationships in more fruitful ways. We are driven by keeping to core values of collaboration, of openness, of respect, and of empowerment. The Western New South Wales Local Health District Board is led by the principle that we should have safe, high-quality clinical practice, provide services as close to where people live as possible, and have a sustainable approach to the delivery of health care. This triad is paramount in our strategic thinking. We are all here tonight because health is an issue that affects everyone, regardless of how young or old you may be. This forum is a unique opportunity to voice your concerns, raise questions, and make suggestions. So, you are invited to let your voices be heard and counted. We are here to listen. Thank you.